Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. Onir from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
Apparently, people have been asking for stories of career-changing cases that changed your mindset, changed your approach, your style, changed what you do. And these can be bigger or smaller changes. But let's start with that. Dr. Onir, tell me about a situation, someone you saw, that made you do a 180 in how you were doing things.
So I've been thinking about that. And the one case I could think about was actually my stepmother. I started doing her lips, and I think most lip injectors, they put on a little bit of numbing cream and they go and inject. And that's what I did. That's how most.
So because it was your stepmother, you did no numbing of any kind.
No. I actually do like her a lot. We get along really, really well. So I numbed her up just like I would any other patient, just, with a topical. And I started doing one side, and then she stopped me and she said, "We're done. I can't bear this anymore." And I knew I couldn't let her walk around with just one lip.
Truly having a good side.
Yeah. So then I said, you know what? I'm a dentist. I can inject numbing medications. So let's put some lidocaine, just like we would inject anyone where I'm doing a filling or anything like that. And I injected her, and she was so much more comfortable. I was able to complete everything and just make it look amazing. And that's what we did. So ever since then, that's how I proceeded. I numb patients like I would when you go to the dentist, and kind of get everything all numb, and you can play around with it and really get awesome results. Since then, that was when we were doing cannulas and really like injecting and poking and doing that whole thing. Nowadays, we do more of that vertical lip lift. So people have to realize that even injection techniques change as the time goes. So everything changes. So we now don't actually need to do so much of that lidocaine injections where you're completely numbing the patients. You could just do with a topical numbing spray, which works really, really well as well. And you can get beautiful results in the lips and elsewhere. So, but it's always good to go somewhere when you're going to get some kind of treatment where you feel like you may not be all that comfortable, to go somewhere where you can get that lidocaine injection, because sometimes the topicals for most patients, it could work like 90% of the patients, 95% of the patients, but you're always going to have 5% of patients, and you may be the one listening right now who falls in that 5%, 3%, whatever, that just the topical will not work for you for whatever reason. You need to be in a place where they can just say, okay, hold off. Let's just inject some numbing medications like lidocaine and that sort of thing, and really get you through it. Make sure you're comfortable, get the job done.
So for me, I think I can think of a lot of them. And a lot of these situations altered my approach to things, changed how I perceive things, changed my entire understanding of what's attractive and what's not attractive. But the one that I'm thinking of right now is a younger person who wanted a facelift. And this has come in as a situation several times. Even people in their 20s have come to me with, I want a facelift. And you think to discount this off the top, right? You're not even worth a conversation. Like, in your 20s, oh, come on. Mm-hmm. Like, come back in 30 years. Mm-hmm. And I think that's a very old way of thinking, because a facelift is not, or should not be thought of as exclusively something to make you look younger. A facelift could really be called a face optimization. What we're really thinking about is, all right, what is not right on the contours of your face? What could be better? And it could be a genetic thing, that you were just born with fuller cheeks, more full jowls, a very short neck, a thick neck. It could be that you had acne in your teens, and this destroyed some of the collagen in your face, and lasers and Morpheus and fillers have taken you so far, but they're not getting you where you want. And it's really going to be redistributing the tissues underneath that's going to reconstruct things. So our field is plastic and reconstructive surgery. And there's a blur between cosmetic surgery and reconstructive. In many ways, the anti-aging, or the things that restore your face to the way they could look or should look, are reconstructive, while at the same time cosmetic. So I think, especially with the deep plane facelifts and the extended deep plane facelifts and the vertical facelifts and all the terms that people use, that changed for me, where I no longer think that there's an age of entry, right? It's not like you need to be 21 to get a glass of wine at the restaurant here in Massachusetts. It's not like, oh, you're 44, but I see it. You have certain sun damage, you have certain hollowing, you have certain lines and grooves, and there's no reason for you to spend the next 20 years feeling like you want this and waiting for it, because it works. And that was the thing that really made a big difference for me, was seeing some of these younger patients and having them convince me early on that they should do this, and then me sort of relenting and saying, okay, fine, and then going, oh, what do you know, that really was a good idea. You were right, I was biased.
Sometimes you have to go with the patient, like if they really want like a certain procedure, like let's say a lip lift, they really want it, and they push and they push it and they push it, and then eventually you just say,
eventually you say, you know what, you're right, you were right the whole time, you're absolutely right, even if you think it's borderline or that kind of thing, you are fully correct, absolutely right.
You know what, it's actually, I've observed the same thing with young facelift patients. When I talk to someone who's on the younger age, oftentimes they're sort of insecure about it. They go like, am I too young to be here to be discussing this with you? And I tell them, actually, in fact, a lot of my happiest facelift patients, or among my happiest facelifts, are the younger ones. And it's like that thing that they get to live with it longer, they get to enjoy it longer from a younger age, and have that sort of self-image that they want now, rather than delayed gratification, waiting on something till later.
Absolutely right.
And they heal better, right? I mean,
they
when
heal
you're
well.
younger,
I just got asked that question. Do you heal better when you're young? I don't know about that. I think you heal well when you're healthy. Like, so if you're older and healthy, you're going to heal fine too. And if you're young and not healthy, you're not going to heal well.
And you've got the hyperbaric oxygen chamber. Well, that just moved all the healing.
That'll fix everything.
Yeah.
Your story reminded me of a story, actually. So I think the theme of this one would be, what's the phrase? Necessity breeds innovation.
Yes.
Mm-hmm. So
necessity is the mother of innovation.
I'd say one of the biggest paradigm shifts in my surgical practice has been around brow lifting. And if you look at like the history of brow lifting, or at least the way they teach it in surgical residency, is that there's like a few main types of brow lifts. A coronal brow lift that requires a long incision and moving the scalp back, or a long incision here and moving the scalp forward and
in front of the hairline,
or now endoscopic brow lifts. I had a patient who had hooding out here, so very low lateral brow, and he was curious about blepharoplasty surgery because there was so much eyelid hooding, but his wife absolutely did not want him to have a blepharoplasty. She thought like the scarring would be too visible, so he came to me and was like, look, is there anything that you can do for this where you don't need to make an eyelid incision that she'll notice? Like something that, no scar, nothing would ever notice. He's an older gentleman. He was, I think, in his 70s or maybe even like around 80 years old. So we wanted to avoid general anesthesia. Something simple, quick that we could be doing in the office. We designed like a type of brow lift that we call a temporal brow lift, a lateral brow lift now, that I hadn't done in fellowship. I hadn't heard about it in residency. It took me some digging to come up and design the right procedure for him, but it was something that we were able to do under local anesthesia in the office. So these necessities of like the constraints that he's giving me, something you can heal from quickly.
And only your left hand.
Yeah. And it worked beautifully. It achieved exactly what we wanted to do. Low downtime, 1 week.
Incisions hidden in the hair.
It's sitting like right behind the hairline. There's nothing visible on the scalp. And now that's the most popular type of brow lift that I do.
Yeah.
It's the lateral brow lift.
That's
and I
amazing.
love it. And I do it in the office all the time.
That's
and
right.
If that person hadn't walked into my life, it probably would have taken me years to discover this and start doing
Think
it.
of a reason. Yeah, that's right. It's a give and take. You get challenged with come up with something, and then sometimes you think, well, gosh, what you're asking me to do is new and different, and that's actually how a lot of the feminization procedures started for me, which is, back in the last millennium, people started asking for these things, and it's like, well, gosh, what does that involve? What does this mean? I know it sounds really old, doesn't it? and then you realize we need to solve a problem that hasn't been thought of before. And I was just talking to someone about calculus downstairs, actually. And calculus, for those of you, I don't mean to cause trauma for those of you who took that back in high school or wherever, college, but calculus was invented by two different people out of necessity. They had a question they needed to solve, and there was no math that could do it, so they designed a system of math that would allow them to solve the problem. And that's kind of what we're talking about here. Is people will present you a problem, and there's no surgical technique or no approach or no thought process for that. So you have to rethink everything and come up with a way of doing it. And that's part of our mission here, is to be innovative in finding solutions to help people reach their goals.
I'm Isaac Newton, and you're Leibniz.
Leibniz, or the other way, whatever.
And now,
I'm happy
and
to
now
be Leibniz.
teens are now tortured for the rest of the rest of eternity with
It's also
calculus.
called the convergent evolution, I think, or something
That's
like
right.
that, where it's basically the same, flight evolved in mammals and bats, and it also evolved in birds.
And reptiles to birds, yeah, that's exactly
And,
right.
it's basically people come up with the same ideas, necessity.
And just like Leibniz and Newton have resulted in torture for so many high school students, many of our innovations have resulted in book chapters and test questions for the next generation of plastic surgeons.
Oh, that's funny. That's so true.
we're being just as difficult on the future as they were to us.
And on that note,
Yeah.
thank you
Well, yeah.
No, go ahead.
Well, thank you for listening to Plastic Surgery Secrets Talk.
If you'd like to hear more about what we do and want to get in touch, call us at 617-566-3223 or email us at info@drspiegel.com. That's the I before the E, so DRSPIEGEL.com.
Do we have social media also?
We do, at Dr. Spiegel, all of them.
Excellent.
YouTube, TikTok,
Instagram.
Facebook. Oh my God.
MySpace.
Even X.
Thanks for listening.
Thank you.